Good afternoon. This is Jennifer Lee, your Medicare 360 show host. And today we are continuing our journey into finding out what Medicare covers. So we are on page 29 on the Medicare and You Handbook. What does Part B cover? Medicare Part B medical insurance helps cover medically necessary doctor services, outpatient care, home health services, durable medical equipment, mental health services, limited outpatient prescription drugs, and other medical services. Part B also covers many preventive services. Go to page 30 to 55 for a list of common Part B covered services. Medicare may cover some services and tests more often than the timeframes listed if needed to diagnose or treat a condition. Find out if a Medicare covers a service that isn't on the list. Medicare.gov/coverage or call 1-800-Medicare. What do I pay for services Part B covers? The list of covered services is in alphabetical order on the following pages. It gives general information about what you pay if you have original Medicare and use doctors on other healthcare providers who accept assignment, pages 59 to 60. You'll pay more if you use doctors or providers who don't accept assignment. If you're in a Medicare Advantage plan or have other insurance like Medigap, Medicaid, employer, retiree, or union coverage, your out-of-pocket costs like copayments, coinsurance, or deductibles may be different. Contact your plan for more information. Under Original Medicare, if the Part B deductible applies, you must pay all costs up to the Medicare approved amount until you meet the yearly Part B deductible. After you meet your deductible, Medicare will pay its share and you typically pay 20% of the Medicare approved amount. If your doctor or other healthcare provider accepts assignment, there's no yearly limit on what you pay out of pocket or if you have original Medicare. There may be limits on what you pay if you have supplemental coverage like a Medigap, Medicaid, employer, retiree, or union coverage. You pay nothing for most covered preventive services if you get the services from a doctor or other qualified healthcare provider who accepts assignment. However, for some preventive services, you may have to pay a deductible, coinsurance, or both. These costs may also apply if you get a preventive service in the same visit as a non-preventive service. So let's go over Part B covered services as well. The Apple icon is next to the preventive services on pages 30 to 55. Preventive services: abdominal, aortic, aneurysm screenings. Medicare covers an abdominal, aortic, aneurysm screening. That was pretty hard to say. Ultrasound, once if you're at risk, only with a referral from your doctor or other qualified healthcare provider. You're considered at risk if you have a family history of abdominal, aortic aneurysms, or you're a man 65 to 75 and have smoked at least 100 cigarettes in your lifetime. You pay nothing for the screening if your doctor or qualified healthcare provider accepts assignment. Acupuncture. Medicare only covers acupuncture, including dry needling, for chronic low back pain. Medicare covers up to 12 acupuncture visits in 90 days for chronic low back pain, defined as lasting 12 weeks or longer, not having an identifiable cause. For example, not an identifiable disease like cancer that has spread or an infectious or inflammatory disease, pain that isn't associated with surgery or pregnancy. Medicare covers an additional 8 sessions. If you show improvement, you could get a maximum of 20 acupuncture treatments in a 12-month period. The Part B deductible and coinsurance apply. If you aren't showing improvement, Medicare won't cover the 8 additional treatments. Not all providers could give acupuncture, and Medicare can't pay licensed acupuncturists directly for their services. So you definitely need to make sure your acupuncturist takes Medicare. I find that not a lot do, because usually they just don't know or don't want to have the hassle of contracting with Medicare to get this done. Advanced care planning. Medicare covers voluntary advanced care planning as part of your yearly wellness visit. Page 54 to 55. This is planning for care you would get when you need help making decisions for yourself. As part of advanced care planning, you may choose to complete an advance directive. This important legal document records your wishes about medical treatment in the future. If you aren't able to make decisions about your care, you can talk about an advance directive with your healthcare provider. They could help you fill out the form if you prefer. We also have these forms, so let us know, and we will help you with that. Consider carefully who you want to speak for you and what directions you want to give. You have the right to carry out your plans as you choose without discrimination based on your age or disability. You could update your advance directive at any time. You may pay nothing if the service is given as part of the yearly wellness visit and your doctor or other qualified healthcare provider accepts assignments. Medicare may also cover if it is part of your medical treatment. When advanced care planning isn't part of your yearly wellness visit, the Part B deductible and coinsurance do apply. Need help with your advance directive? Visit the Elder Care locator, eldercare.ac.gov to find help in your community. Let's keep going. Preventive service, alcohol misuse screenings and counseling. Medicare covers an alcohol misuse screening for adults, including during pregnancy, who use alcohol but don't meet the medical criteria for alcohol dependency. If your primary care doctor or healthcare provider determines you're misusing alcohol, you could get up to 4 brief face-to-face counselings per year if you're competent and alert during counseling. You must get counseling in a primary care setting like a doctor's office. You pay nothing if your primary care doctor or other healthcare providers accepts assignment. Ambulance services. Medicare covers ground ambulance transportation to a hospital, critical access hospital, rural emergency hospital, or skilled nursing facility for medically necessary services when traveling in any other vehicle could endanger your health. Medicare may pay for emergency ambulance transportation in an airplane or helicopter. If you need immediate and rapid ambulance transport that ground transportation can't provide. In some cases, Medicare may pay for medically necessary non-emergency ambulance transportation if you have a written order from your doctor stating that ambulance transportation is medically necessary. For example, a patient discharged from the hospital may need a medically necessary ambulance transport to a skilled nursing facility. Medicare will only cover ambulance transportation to the nearest appropriate medical facility that's able to give you the care you need. You pay 20% of the Medicare approved amount. The Part B deductible will still apply. Ambulatory surgical centers. Medicare covers the facility service fees related to approved surgical procedures done in an ambulatory surgical center, outpatient facility that performs surgical procedures, and the patient is expected to be released within 24 hours. Except for certain preventive services for which you may pay nothing if your doctor or healthcare provider accepts assignment. You pay 20% of the Medicare approved amount to both the ambulatory surgical center and the doctor who treats you. The Part B deductible applies. You pay all of the facility service fees for procedures Medicare doesn't cover in ambulatory surgical centers. Let's keep going. We are on page 32. Costs and coverage. Get cost estimates for ambulatory surgical center outpatient procedures at medicare.gov/procedure-price-lookup. Bariatric surgery. Medicare covers some bariatric surgical procedures like gastric bypass surgery and laparoscopic banding surgery when you meet certain conditions related to morbid obesity. For cost information, visit medicare.gov/coverage/bariatric-surgery. Behavioral health integration services. If you have a behavioral health condition like depression, anxiety, or another mental health condition, Medicare may pay your provider to help manage that condition. Some providers that manage behavioral health conditions may offer integrated care services like the psychiatric collaborative care model. This model is a set of integrated behavioral health services, including care management support that may include care planning for behavioral health conditions, ongoing assessments of your condition, medication support, counseling, other treatment your provider recommends. Your healthcare provider will ask you to sign an agreement for you to get these services on a monthly basis. Your Part B deductible and coinsurance will apply to the monthly service fee. Let's move on to blood. Always never really knew about this blood. It's kind of creepy, right? A little bit. Blood. If the provider gets blood from a blood bank at no charge, you won't have to pay for it or replace it. However, you'll pay a co-payment for the blood processing and handling services for each unit of blood you get. The Part B deductible applies. If the provider has to buy blood for you, you must either pay the provider cost for the first 3 units of blood you get in a calendar year, or you or someone else could donate the blood. This is a little bit technical, a little bit dry this show today, but it's okay. It's good to know what Part B covers. Preventive service on bone mass measurements. This test helps to see if you're at risk for broken bones. Medicare covers it once every 24 months more often if medically necessary. For people who have certain medical conditions like possible osteoporosis or meet certain criteria. You pay nothing for the test if your doctor or other qualified healthcare providers accept assignments. Cardiac rehabilitation. Oh my gosh, I can't speak today. Medicare covers comprehensive programs that include exercise, education, and counseling if you had at least one of these conditions: a heart attack in the last 12 months, coronary artery bypass surgery, current stable angina pectoris, chest pain, a heart valve repair or replacement, a coronary angioplasty, a medical procedure used to open a blocked artery, or coronary stenting, a procedure that used to keep an artery open, a heart or heart-lung transplant, stable chronic heart failure. Medicare covers regular and intensive cardiac rehabilitation programs. Medicare covers services in a doctor's office or hospital outpatient setting. You pay 20% of the Medicare approved amount if you get the services in a doctor's office and a copayment in a hospital outpatient setting. The Part B deductible applies. Preventive service, cardiovascular behavioral therapy. Medicare covers a cardiovascular behavioral therapy visit one time each year with your primary care doctor or other qualified primary care provider in a primary care setting like a doctor's office to help lower your risk for cardiovascular disease. During this visit, your doctor may discuss aspirin use if appropriate, check your blood pressure, and give your tips on eating well. You pay nothing if your primary care doctor or health provider accepts assignment. Preventive service, cardiovascular disease screenings. These screenings include blood tests for cholesterol, lipid, triglyceride levels that help detect conditions that may lead to heart attack or stroke. Medicare covers these screenings, blood tests once every 5 years. You pay nothing for the test if the doctor or qualified healthcare provider accepts assignment. Caregiver training resources. This is new. Medicare now covers training that helps your caregiver team and develop skills to care for you, like giving medication, personalized care, and more, as part of your treatment plan. If your healthcare provider determines that caregiver training is appropriate for your treatment plan, your caregiver can get individual or group training sessions from your provider without requiring you to be present. Training must focus on your health goals, and your treatment must require a caregiver's help to succeed. You pay 20% of the Medicare approved amount. The Part B deductible applies. Let's move on to preventive service for cervical and vaginal cancer screenings. Medicare covers Pap tests and pelvic exams to check for cervical and vaginal cancers. As part of the pelvic exam, Medicare also covers a clinical breast exam to check for breast cancer. Medicare covers these screenings tests once every 24 months in most cases. Medicare covers these screening tests once every 12 months if you're at a high risk for cervical or vaginal cancer, or if you're childbearing age and had an abnormal Pap test in the past 36 months. Medicare also covers human papillomavirus oh my gosh, papillomavirus HPV test as part of a pap test once every 5 years, or if you're 30 to 65 without HPV symptoms. You pay nothing for the lab test, the lab HPV with the pap test, the pap test specimen collection, and pelvic breast exams if your doctor or other qualified healthcare provider accepts assignments. So as you can see, there's a common thread of accepting assignment, meaning do they accept Medicare, right? Okay, let's go on to more C's. So C for chemotherapy. Medicare covers chemotherapy in a doctor's office, freestanding clinic, or hospital outpatient setting if you have cancer. You pay a copayment for chemotherapy in a hospital outpatient setting. You pay 20% of the approved amount for chemotherapy in a doctor's office freestanding clinic. The Part B deductible applies. For Part A covered chemotherapy in an inpatient hospital setting, go to inpatient hospital care on pages 27 and 28. I say this is really important because Part A is the hospital, right? Part B is the medical, and both are covered and priced or billed accordingly to which one you're using. Chiropractic services. Medicare only covers manipulation of the spine to correct a subluxation when the spinal joints fail to move properly, but the contact between the joints remain intact. You pay 20% of the Medicare approved amount. The Part B deductible applies. So let's make sure that you're understanding this, because a lot of chiropractors may not accept Medicare. They don't know how to build Medicare. And if they do, keep in mind it's the sublation when the spinal joints fail to move properly, but the contact between the joints remain intact. Side note, if you do have a Medicare Advantage plan, typically they allow you to go for a certain amount period, but only for this type of service. And then also, they're not going to do anything more. A lot of chiropractors tell my clients that their plan isn't great. But just keep in mind, this is the only chiropractic service that is covered. So yeah, it isn't that great if you think about it. The massage is not included unless for some reason that Medicare Advantage plan has that. So keep that in mind. We did cover a lot today on what Medicare covers on Part B. We will continue our journey next week. We're sticking on page 34. There's more C services like chronic care and chronic pain, clinic research studies, etc., that we will definitely go over. Hope you find this enjoyable. Once again, my name is Jennifer Lee with the Medicare 360 show. You have a wonderful day, and I will see you next week. Take care.